I'm Susan Michaels-Strasser. I'm the Senior Implementation Director for Human Resources for Health at ICAP at Columbia University in New York City. Join me as I talk to some of my friends and colleagues working in nursing around the world today. In today's episode, we speak with Dean Ann Kurth, former professor at the Yale University School of Nursing, YSN, my alma mater, and professor of epidemiology of microbial diseases at Yale School of Public Health. An epidemiologist and nurse-midwife, Dr. Kurth's research focuses on global health system strengthening in the context of climate change and other planetary stresses, including the current coronavirus pandemic.
It's really such a pleasure just to see you, for you to be doing this series. So thank you for that.
Thank you. Thank you for your time. I know it's an incredibly busy, stressful, unsettling time, but together we'll get through this. And I appreciate you taking a few minutes to capture this moment in time and really mark this moment that we are all experiencing amidst the COVID-19 outbreak. You are, of course, a world-renowned expert in nursing and midwifery, but before we get started, I'm hoping that you would share some of your journey in nursing and midwifery. First of all, where and how did you become a nurse?
Okay, thank you. Thank you for that opportunity. You know, I don't love talking about myself, but I love being a member of our nursing tribe and family across the world. And so for me, it was a bit of a sort of a circuitous path in many regards, but I would say that where I got started was from the fact that both my parents are health workers and they volunteered their time in summers when I was a child. So from an early age on, I was able to see that there were many ways in which people live around the world, around the United States and around the world, with very different sets of resources and opportunities, as well as, you know, cultural strengths and assets. So I would say that's what set me on my journey. I did go to Malawi after I graduated from college. And that was right before the HIV pandemic hit. So it was, of course, spreading. No one knew. Came back and was scheduled to do my master's in public health at Columbia University. But my experience in Malawi and from my childhood exposures to seeing people living in lower resource settings really made me feel like I wanted to have some clinical background. As well. And so I think, as you and I both discovered, the Yale School of Nursing GEPIN program, which was a direct entry, non-bachelor's background program, and I did do that and became a certified nurse midwife and an RN through that route. But this was all happening at the time that HIV was, of course, exploding in the United States, and so got involved with HIV work kind of contiguously with becoming a nurse. And it's very much been integrated in my thinking and my approach and my framing, and has much relevance to today's COVID crisis.
It sure does. Yeah. Thank you. Thank you for that introduction. Nurses are so important right now. And building on that, one thing I have seen a lot in my career is the sidelining of nurses. And today we're really seeing nurses held up and other frontline health workers as the foundation of this response and being talked about as heroes. We see this in terms of media coverage, of course, but also in health facilities. You know, in the past, it was hard to get the voice of nurses out there and hard to share that. And right now, actually, we're seeing those stories come out, which is an unfortunate time to really recognize the vital foundational role that nurses play in healthcare, health systems, and in public health. And where do you right now see nursing in healthcare delivery?
Well, you know, I have always believed, and the data show, that nurses and midwives are the foundation and the backbone of every health system everywhere. Now, has that always been acknowledged and supported to the extent that it should be? Absolutely not. And I think what this current crisis is revealing, as they often do, are the cracks in the system, the hierarchies that really should not be tolerated. And again, I would say the opportunity to move forward. The coronavirus pandemic is going to remake us. There's simply no other way of saying it. We've lived through HIV, we've lived through Ebola. There have been other originally zoonotic diseases that have happened, but this one has really revealed how interconnected and interdependent all of us are. The nasopharyngeal swabs that we need for COVID testing, they're made in northern Italy and in China. That supply chain breaks down, look what happens, we can't test. So, that interconnectedness, and again, the foundational delivery of healthcare and preventive care and community care by nurses is, I think, being appreciated, as you said. Mm-hmm. It's a moment to really talk about what we do and seize it not in an opportunistic way, but as an opportunity. We were just discussing before this session started about the year of the nurse that WHO has now extended, right, because of the crisis. The Nursing Now campaign and other sort of messaging campaigns that have been out there. I think at this point, people will really see and experience how crucial nurses are to the functioning of health systems. We're doing something, we're starting something at our School of Nursing. We're just going to be asking our faculty and students to just record on their phones. We're calling it end of shift, just to record their impressions and their experiences. Obviously not interfere, no patient data or HIPAA issues, but just end of shift. We know that people are going to be, including nurses, are going to be engaged, as they already are, in making some awful kind of decisions around ventilator use and resource constraints. Mm-hmm. Of course, our colleagues in lower and middle income countries have been dealing with those decisions for other conditions for a very long time. So I think we cannot lose that framing around how nursing and health are so crucial in the Sustainable Development Goal framework of equity, economies, the environment. All of that's what this pandemic is about. The COVID crisis is an example of planetary health, right? We moved into the bats' ecosystem niche. We cut down their trees. And so, pathogens and including novel pathogens occur. So nursing has always been there for these kind of crises. I mean, we are obviously acknowledging, and I love your letters to Florence Nightingale concept. She was an epidemiologist. She understood prevention. Yes. She understood the importance of balancing human activity with environmental activity. All of those principles are still at play.
It rings so true. I was reading some of her quotes the other day, and I'm like, yes, it speaks today to us. And I completely agree with you. This pandemic has shown the fissures in our system. It's shown the inequity. It's shown all of those cracks that you and I have talked about for many years and known, and seeing them. I think for me, what is particularly challenging right now is seeing so much of the resource limitations that I knew existed and have lived through in Africa, seeing right here in a resource-rich country, and seeing those cracks really being magnified and shown to the world that we don't have a strong foundation of public health system, and we are extremely vulnerable. As you said, the supply chain for many of infection control supplies are in limited settings. And for years, we've known the primary supplier is in China. And if anything happens, there is incredible vulnerability there. And it has taken this pandemic to really put the glaring spotlight on that. And we all need to pause and consider what we need to do in the future to make sure this does not happen again. Could you tell me, and I really like the idea of the end of shift recording, because this is a historic moment and we need to get the voice of nurses documented and captured because of the witness to what they are experiencing, what their patients are experiencing, the decisions, as you said, they have to make, the moral injury that comes with having to such difficult ethical decisions, the pain and suffering that they see in front of them repeatedly. How do you see nurses right now responding to the crisis? What are you seeing?
Yeah, so we're seeing the whole range of human emotion. Concern about the possibility of infecting one's family because of lack of PPE, which is, as you say, unconscionable.
Yeah.
The country that spends the most money on healthcare in the world for not the best outcomes. Really, we cannot deal with a mask supply. So, there is that concern. There is, perhaps justifiable anger about that there hasn't been better planning and better protection for our protectors, who are the health workers, and also the heroic. And, I guess I wouldn't even frame it as heroism, Susan, right? This is what we do,
Yeah.
right?
Yes.
We are supposed to be advocates. And we do need to advocate for the vulnerable in this crisis. I mean, right now, half of humanity is locked down, 4 billion people. What does that mean if you were living on $1 a day and had to be out in the street to make your living and feed your children? How, the vulnerability right now of urban poor and vulnerable populations around the world is really frightening. That's an advocacy question that Nursing Everywhere is engaged with, as well as ensuring that we can do our job professionally with the protection that we need, with the equipment that we need, and that should be available everywhere. And the fact that it's not available in the United States, I think, has been eye-opening for the general public. I think there is this mythology that we don't need universal health coverage because we have the access to the best care in the world, and I kind of want that access for me and mine if I need it. And now we're showing, that as you can see in New York City, just this complete devastation of hospital systems, really straining things, and again, then revealing the cracks, revealing the hierarchies. But we're pragmatists and we're positive people as nurses.
Mm-hmm.
We have to come out of this on the other side better. We have to come out better. If we can find out that, it turns out you actually can send a lot of people home from the prisons and you don't need to have a prison industry. Okay. Do we need to have that same prison industry and that same level of incarceration in the United States after this crisis? It turns out that you can actually have the governors lift Scope of Practice Act constraints on nurse practitioners.
Yes.
Wow.
Yes.
Called for decades.
Like that.
The National Government Association asked for, Institute of Medicine, National Academy of Medicine called for it. Suddenly they can do it by fiat. Right?
Exactly.
So it shows that we can actually move quickly towards ways of doing and ways of being that maybe will make a better and more equitable world. I'll come back to the health workforce thing because, Susan, you've been an incredible proponent and professional, and you have moved the field forward so much with nursing education for health systems and nursing production for health systems. So crucial, such important work. Really, we owe you and your colleagues a great debt. But I always say, as someone who's now engaged in actually educating the next generation, or supporting my faculty to educate the next generation of nurses who are so crucial for every health system, we can't keep doing things exactly the way we've always done it for 30 or 40 years. This idea that you have your lectures and you talk to your class in a PowerPoint, and then you're supposed to go and be precepted by someone who's gracious and open and able to precept you in a very busy, constrained health system. That system won't keep working. And now suddenly we're engaged in probably the largest natural experiment in clinical education in our recent history, in the United States at least, which is to say, not only moving our didactic content online for most of us, but now because health systems are so strained, they don't have PPE for their own staff, they can't handle students, they've shut out students, right? And we've suspended people. Now we're doing virtual and online clinical experiences. And of course, we have an evidence base around simulation. It needs to be applied to graduate nursing education as well as undergraduate. But I think it will show that there are ways that we can try to make our education of the next generation of nurses perhaps more efficient and effective, because as you know so well, we're not hitting the numbers. And that was before this crisis. Right. Yes. We know what the nurse shortages are around the world. We're not going to keep scale. The way we have been educating is not going to be scalable enough to meet that demand. So what can we learn from this awful crisis to salvage towards that greater need and end?
I think that's a really good point, and it has been a persistent problem for so many years, and especially, as you said, in low resource settings where nurses really are the primary care provider. There aren't doctors and laboratorians and physical therapists there, and really they have to do so much with so little backup behind them, and finding these alternative, more efficient, as you said, ways to educate our health workforce and truly get the numbers that we need to marshal a comprehensive primary healthcare public health response to safeguard the world. Yes. And clearly we're not there. As you said, half the world is in lockdown. It's mind-blowing. It's absolutely sends shivers and really is a wake-up moment for all of us. And it's amazing and great to see how you have so rapidly regrouped and been able to adapt and still give the students at YSN a quality experience. And I'm sure they are grateful that it's, even in this difficult time, is continuing, and they will come out of this and they will be strong healthcare providers. I want to pivot slightly. We talked a little bit about the challenges in other countries and in what we are experiencing now in this resource-rich country that still has significant challenges, ethical dilemmas, existential crises with this COVID-19 outbreak. What should nurses in Africa be taking away from the pandemic response? What would you like them to be gleaning from what they are seeing here in the United States and Europe with the significant rise in new infections and deaths?
Yes, well, I mean, as you point out, nurses in lower income country settings are completely the unsung heroes. They are asked to do so much, and they do so much with so few resources and support often. I guess, stepping back and talking about what lessons are we learning from management of the COVID crisis, we have better and worse examples of large-scale tools that health systems and governments can do. So, for example, early and widespread testing in South Korea, really made a difference, and we have just bungled the test availability issue here in the United States. Is a nurse in Malawi going to be able to advocate for, point of care, state of the art SARS-CoV-2 testing? No, probably not. But what do we know from other epidemics, especially infectious epidemics, is crucial, and that is trust, that is communication, right? That is linking with the communities most at risk. We saw that go awry with Ebola in some places, and we saw it go well with Ebola in other places. So we know that some of those basic principles of communication science and connection to communities is crucial, and nursing is generally trusted, certainly the most trusted profession in the United States and trusted around the world. Some of the basic principles around physical distancing and hand washing, goodness gracious, that's nursing all over, right? And so I think the principles around communication, the idea of being able to sort of think about managing the healthcare delivery for the more mild cases of COVID and have it be more home-based and provide, information and support around that. Again, it always has to be a team effort, whether it's in a very high-tech academic health center in the United States or in a smaller rural clinic and regional hospital. We need the team-based approach, which is not just the nurse, of course, but the activated patient and their family. So being able to provide information, because, here we are in the United States about to make some terrible choices and difficult choices around ventilator access, including because it seems as though the clinical presentation of COVID is that people don't get off the ventilators very quickly or very often, actually. And so they're going to be on for extended. So we have too few ventilators. They're going to be on for even more extended periods, perhaps. Yeah. Those bioethical committees are going to be making some very traumatic choices. And this is in a country that has so much money and equipment. So how many ventilators are available in sub-Saharan Africa? I have not even seen the numbers. Yes. What kind of alternatives can people come up with? We're all doing these very creative and clever hackathons and working with our nurses and engineers, who are always a great team for, what can we do to multiplex the current ventilators? Can we modify the CPAP machines, because there's a lot of those out there? Can we 3D print masks, for goodness sake, to protect our health workers who, I have had faculty tell me about intubating COVID patients without protection,
Mm.
and it's usable. But in a lower income country setting, none of that's even being discussed. The supply chain for masks right now is being fought over, and the pricing's gone up. It's quintupled in the United States. So everyone's in a bidding war because they have the money. Who's delivering masks, in sub-Saharan Africa? So,
Yeah.
where people don't even have water to wash hands sometimes, as we know, right? So again, coming back to the advocacy approach, coming back to the fact that we're all a member of the nursing family, and how do we advocate for each other and for our vulnerable populations to get through this crisis. And then I frankly am quite concerned about the co-terminal mental health impact and then the after effects. I think we're going to have a fairly traumatized generation, and again, of health workers, and
Yes.
you and I were just talking about the comparison of this to the HIV pandemic that many of us lived through. It was somehow, it was more marginalized. Let's be honest about that. We didn't see the general public get incredibly engaged and frightened and concerned early on with HIV
Yes.
anywhere. And the science moved more quickly than science used to. Science is moving very quickly with the COVID, but
Right.
we still don't have an HIV vaccine 30 years later. We need a COVID vaccine, right? So, I just think that being able to pull together the science, the clinical practice excellence, including those fundamental principles of infection control, the community connection and advocacy, those are all in our toolkit for nursing, and we just are pulling them out for this one.
Yeah. You've raised so many important points. The inequity we see. Another thing that I think about is the need for minimum standards to protect our frontline health workers at all times.
Yeah.
I mean, why can't we develop PPE that is durable and can be sterilized and decontaminated? And having our health workforce go out there and be intubating patients without the adequate protection is, as you said, unconscionable, and we can do better. And I've said this for a few years. Why don't we have minimum standards for good times and bad times for all health workers? Those basic protective equipment that we all have in our backpack or our toolkit. Because, as you said, the nurses, the doctors, the health workers, they will rush in. They will be there to provide the care. But at a minimum, they have to be able to protect myself. And I was thinking about this yesterday, the amount of mental fallout and trauma fallout from this. And I still feel those scars from HIV working on the front lines in Africa. What you see sticks with you. It doesn't go away, and it affects who you are and what you become. And I think one of the challenges for us as leaders and educators is to, as best we can, shape this as a time to build resilience, to build wisdom, to build voice, and to take that trauma and work productively to make it a better world. And that's nice sounding and easy to roll off the tongue, but something very hard to do, to process those painful experiences and help people to come out of it stronger, more wise, more demanding for what is right, and people have that sense of justice and equity and minimum standards. And right now, I feel that our nurses and our frontline health workers are really, really hitting against all of those disparities and having these crises at so many levels as they grapple with this emergency.
Again, it reveals, right? It reveals. And we were already very concerned, certainly in the United States and around the world, with the level of burnout amongst existing clinician, workforces. With our students, many of us know who are in schools of nursing, there's already a high level of need for mental health services. And that was all pre-COVID, right? So this is going to be a crucible that hopefully will fire us towards being stronger at the end, but it also will be very damaging. And so again, we're already trying to figure out how we stand up tele support groups for clinicians, grief and PTSD processing support groups now in real time, right?
Oh, that's great.
Yeah.
Yeah, it's so important, and I think it is so valuable. And I know when I was first training to be a nurse 30 years ago, it wasn't really discussed. And that trauma, that those experiences, as I said before, and as you've said, really stick with you and shape who you become.
Yeah.
Um, I'd like to just take the conversation slightly different right now. And what should we, as the general public and as people in the health field, be doing to care for our nurses? You talked about helping them to deal with the trauma, to have these psychological resources, psychosocial resources. What are some other things that you think the general public should be doing, saying, hearing, preparing for to help protect our frontline health workers and our nurses?
We have a lovely little hashtag that our pediatric nurse practitioner students sent out. They all have a little sign from the unit where it says, "We're here for you. Please stay home for us." So one thing, of course, obviously is just the physical distancing, the 6-foot rule and the not gathering in congregate spaces, taking that seriously, working from home if you can. And of course, not everybody can work from home with us, and it brings in additional stresses. We worry about increases in child abuse or intimate partner violence. Alcohol and substance use with the kind of stress of being indoors. But that said, we know that we need to get through at least this first wave of the pandemic in order not to keep transmitting the disease. And so that's part of it. Advocating for healthcare workers. There's been discussion back and forth about mask use and cloth mask use by the general public versus the N95 and surgical masks and N95 respirators and other equipment for health workers. Again, can we ensure that we're not hoarding these things like toilet paper, but that we're actually saying, nurses, respiratory therapists, the healthcare team first. That kind of advocacy. And look, the reality is, we need science-based, trusted, and evidence-based approaches to dealing with this epidemic. And ultimately, that means voting for people who put that in place.
And I think that is a really great point to round up this conversation. We are at a critical time. I know that some of the conventions and the presidential campaign has really taken a stall, but I think we need to really capture the learnings from this and vote with clear understanding of where we are right now and what the challenges are and how absolutely important healthcare is.
Yes, and also not just to write letters to your politicians and your leaders, but consider running yourself. And of course, now you can't even think about it. But we were quite disappointed. We were going to do the first nurses and midwives candidate school at Yale School of Nursing this summer. We had to suspend it. We'll reschedule it. But out of there are almost 600 candidate schools in the United States. None of them have been for nurses, who are 2% of the voting population. So. We can run for things as well because we we should be running systems, health systems and public health systems, that we know that nursing has the capacity for that. We're educated for it. We see the patients 24/7. We see the system holistically as well. And so ensuring that we step forward to that when the time comes is also an opportunity down the road.
Exactly. And I think we would be at a different place if we have more nurses as leaders, more frontline men and women who've been there at the bedside 24/7. I think if they are in leadership positions, we would have a different health system. And I think we have to, you've suspended it, but it's going to happen. It'll happen when we've come through this outbreak. And I know you will make it happen. I really couldn't agree with more with what you've said. This year, as you know, is the year of the nurse and the midwife. And it just seems very ironic that this is the year of the nurse and midwife as declared by WHO in recognition of Florence Nightingale's bicentennial of her birth. And it really is a moment where the importance of nursing, that combination of care and evidence-based really comes together in such a profound way right now as we deal with a global pandemic. As we celebrate nurses and midwives in our individual lives, our communities, and in our world, it is time to focus on what matters. By building more resilient and well-trained frontline health workers, health systems will be strengthened through this. As you said, Ann, we will get through this. Not only in the course of normal operations do we need to focus on frontline health workers, but as we know right now in this time of crisis, we need to listen, we need to learn, and we need to prepare to respond, to build a better health system, a more just world, a more just healthcare system once this epidemic, this pandemic is under control. I really want to thank you for your time, for your experiences, for choosing nursing, for being such a strong and wise nursing leader, bringing together, as I have, the public health with the nursing. I think it's just a perfect combination, as Florence Nightingale did, to really bring epidemiology and nursing together to build stronger health systems and stronger responses for the most vulnerable in society and for those who are struggling with illness and possible loss of life. So thank you again. And I know you're very busy, so I don't want to take any more of your time. Thank you so much.
Thank you, Susan, for what you do. Thank you to everyone. Stay safe.